Welcome to the Cozy Cocoon, where we discuss all types of trash around the internet. You know, we've all had good and bad days, and sometimes we need to go to the doctor. And sometimes it goes well, you feel better afterwards, and sometimes it gets worse. Today we're gonna discuss the bad ones. Oftentimes, our medical care starts with the EMT, is a very important part of the medical team. So we'll start with something, a classic.
Girl power.
Oh, that's not a light guy.
Catch it! Watch that drop! We're live over Malibu where a stretcher has slipped free from it.
Yo, shoot down.
No competition. Oh my goodness. Bloop. Oh. Oh no! More competition. That's terrifying. Yeah, I wasn't aware there were so many competitions for stretchers, but apparently they seem very difficult. Yeah, it seems like a lot of them are making more harm before they even get to medical care. He thought it was a heart? Well, at least he keeps a positive attitude, a good smile on his face, going through whatever surgery he's going through. Wow, yeah, I would be terrified too in a hospital overnight with whatever illness or struggle they're going through. Yeah, I would be scared too. I feel bad for the other guy. He's obviously in a lot of distress, having a terrible time. Now, if you're not sick enough to have an emergency, don't go to the emergency room. She's always, if you have a tummy ache, you get some sleep, get some Pepto. Don't take up a bed for someone who really do need it. Let's just laugh at someone who is having a much more difficult time than you are. Only go to emergency room as an emergency. Not the first second you feel a slight inconvenience. She's not even trying to hide it, just going to town over there. What did you eat, lady? Oh my goodness. I mean, it's just she wasn't even trying to kind of make it less obvious. She was just going to town. And the guy's in a respirator, so obviously has, a compromised immune system or something related to his breathing. She needs to get fired. That's so disgusting, unhygienic. Putting the guy at risk for no reason.
If I bring my child to a facility that cannot take care of her, there is no need for her to be in the facility. This man just said he cannot submit my child in this hospital because they do not have child stuff for my child. So I have to take my child to another hospital. You can paint me out to be whatever you want me to be. I'm one black man that ain't none of what you think I am.
He'll do anything to protect his child, but doctors refuse to listen.
I don't care what you talking about. What's bad is that you're overriding your position, bro. Because if you're talking about a 2-year-old child, man, and you just said you can't do nothing for it, why would you be trying to keep it for 24 hours? You make no sense, bro.
I know you're a good father. I've been in here with you guys. I know you're a great
That's
stepmother.
a concern about
Love
me
you.
being a dad. That's not the issue. The issue here is about my daughter's well-being and how she is being taken care of.
The cops won't stop him. He knows what needs to be done.
I'm taking my daughter to a hospital that can help her. I am irritated and frustrated as a father because I'm being held back from doing just that. But y'all want me to leave without my child. Would you leave your daughter? Somebody just told you they can't help her.
Her situation is critical. He won't sit back and watch her deteriorate.
She had a seizure. She's 2 years old. Nobody can tell if she's going to have another one. So I don't understand why my parenting is even being in question.
I'm not questioning it at all.
But somebody is.
That's an interesting case. I mean, there has to be a reason why they would be so adamant about not letting him leave with a kid. But then again, it looks like it's just a regular emergency room, and they said that they couldn't treat the kid. So there must be a reason why they wouldn't let him leave. I mean, but he seems fine. I mean, yeah, he's concerned and frustrated, like any parent would. But he's not being violent. He's not being loud. He's not being rude. So I really don't understand. And the cops there has to be something going on. I mean, the most logical thing is obviously leaving and taking her to a hospital where she can be treated. Okay, so she has seizures. Just left her alone, I guess. Oh, they finally noticed.
Is Sarah in there? Alright. Sorry, she's not my patient. Alright, everyone grab a leg or a arm.
Oh well. I guess she did finally pass out. Yeah, I mean, it seems like negligence on the nurse that was tasked specifically to take care of her, and then just left her alone knowing that she's at risk. Also, why would they put her in a waiting like that if they knew she was at risk? I'm not sure. Seems like a lot of bad back practices back to back. Thankfully, that one nurse noticed her and she got help right away, but hope she does better. okay, I can see both sides here. I think she's exaggerating a little bit with the whole rude attitude. I mean, he was being professional. He was asking her if it was okay with her. I don't think he was rude. He's being professional. I mean, you don't have to be called honey or sweetie or it's talked in a high-pitched tone to be called, to be not rude. Like, not everyone does that. And I really don't think he was being rude at all. He was just trying to figure out what the problem is. Why she starts freaking out when, you know. But I also can see her side where she doesn't know what's going on. She's concerned about her pregnancy. Her husband is not there, so she's alone. So that adds extra pressure. So I can see her point too. But I don't think the doctor was in the wrong at all. Especially the random call like that. Yeah, I think she just kind of took it wrong with the added pressure that she already had and the nerves. But that's my opinion. Well, it looks like it was an emergency.
So we finally escaped the urgent care.
Well, it looks like there was an emergency and everyone evacuated like they were supposed to, and you did not for whatever reason. Probably not paying attention. Yeah, they don't just, medical care doesn't just disappear.
Sorry, honey, but this is the only way.
I need a different
I'm
nurse.
the only nurse that you're gonna get
No.
right now.
Okay.
You're gonna give me your hand because you're discharged.
Okay.
Let's
Now,
go.
Can you have Tiffany come back in here?
No, Tiffany's not a nurse, so give me your arm because we're leaving. I'm gonna count to 3 and then I'm getting security. 1, 2, 3.
See, this one is suspicious. It's definitely one of those that you're like, I really, really need the full story, because nurses are usually extremely nice, and even if they're not overly sweet, they're professional, they're polite. Something happened to push her to that point. Something that we're missing. Maybe it was both a fault. Did she sounded condescending and counting down like that? Yes. But I'm pretty certain there was something that pushed her to that point. No one just randomly goes to that level of attitude out of nowhere. Especially someone who deals with countless people in distress situations every single day. There has to be something that happened that we don't know. What are those keys?
They're gone. Pulled straight out of my pocket. Control, this is MRI2. We need engineering and magnet quench assessment. Metal object in the bore.
Yeah, obviously. But see, the lady looked like she worked there. She had like her name tag. Why would she go into that room knowing the very basic rule of no metals allowed? It's one of the strongest metals I've ever created. What? That's such a stupid mistake. Especially someone who works there, that you obviously know that basic rule. Very dumb on her. Could have really damaged the equipment or hurt someone. Oof. Fuck, poor woman.
Lang is her doctor.
Oh my god.
Do y'all treat all your patients like this or just the black ones?
due date is
Just
the
said it
10th.
was the 10th.
She got 3 pregnancies, 2 babies at home. Bet you all listen next time. When you found out you were delivering at this hospital, your ass should have changed doctors.
Oh, I feel so bad for her.
Everybody say how they treat people here.
Yeah, I feel really bad for her. I can't possibly imagine the pain of someone going into labor. That's unimaginable for someone who hasn't gone through it. And I can completely sympathize with her, not in such at the degree as she had to go through, but whenever I had gallstones and I was passing them, it was an intense pain brought me to my knees. I could not function. I was just yelling. I could not walk. I was completely dysfunctional. My husband had to pick me up, put me in the truck, and take me to the emergency room. And when we finally got there, the exact same thing happened. The lady was taking her sweet time, asking for basic data, information, insurance, which, yes, you do need the information, but not right that second. Right that second, you need help. Like, it's an emergency, thus the emergency room. Yeah, so he got mad and he had to start, kind of getting the attention of other doctors to get me help, because I was just getting worse and worse and worse. And then finally they treated me after a long wait. So no, I guess to answer her question, no, it isn't just that one specific race. I think it's just in general, 'cause they did it to me too. I'm sure to many others as well.
Right now.
I want my baby.
Okay. I will press charges
Who-
because
who-
you cannot record us. You have to get consent. It is
But I
all
asked
of
you to give me
And
my
I said
baby,
right
and I'm
now-
being nice, and you're not letting me be
now,
nice.
for the safety of your baby, because you are very
I
hyped.
have not.
Babies are coming.
Cops are already there.
I'm not hype, and I'm not recording. I'm not hype. I said I want you to take your hands off so I can. I call the police, and I just want to leave. That's all I'm saying.
But you can leave. Baby will have to stay here.
No, the baby
Stays
cannot.
for 24 hours.
1 second. I just had a nurse say that I pushed her, and I didn't push her. I didn't do anything, and I'm asking to leave because I don't feel safe here. I'm saying that I want you to just take your hands off my baby and just let me go home with my baby. I just had a C-section.
I know. Everybody wouldn't be able to go home with their baby. Not till 24 hours because there has to be.
But the lady,
and all
the
that
nurse,
stuff. I know.
just said that I hit her.
That's why we're trying to resolve that.
I did not hit anyone. I'm not a violent person, and I just want to go home with my baby. I don't feel safe. I understand that, but due to the allegation, I don't.
That's interesting. So, from what I understand, after you give birth in the hospital, your baby has to at least stay there 24 hours, so they run some screening tests, see if there's any defects, anything that can be caught early on, so they can be treated as soon as possible, and to make sure that everything is healthy, everything is working as it should, which is very, very important for those first 24 hours of the baby. Now, why she would need to escalate to the point where the police is called, I'm not sure. They mentioned some pushing, which, she's saying she didn't. Someone else is saying she did. But then it's a hospital, so there should be cameras around to prove it or not prove it. I'm not sure the full story, why she's so insisting on leaving. That means very basic procedure. Leave the baby there 24 hours for screening. Like the nurse said, I mean, she can go if she wants to. The cop is recording everything. She's recording everything. I don't know. I hope the baby is healthy and that she got to clear everything out and got home safe. Oh, no. No. Yeah, there's literally nothing in this life or the next that could convince me to go through a pregnancy or a birth. Nothing. Absolutely nothing. There is no possible way. There's a reason why there's a genre of horror specifically for pregnancy and birth. It's just unimaginable, and I commend all the mothers out there that ever went through that process, because I guess I'm just not brave or courageous enough. Fuck that. Huh. What? Where did everyone go?
Why is me back here all alone? No doctor, no nurse.
That's weird. I mean, I can kinda see if you're like an adult going by yourself, maybe two adults going by themselves, but an adult with multiple small kids, you don't just forget that. I'm sorry to see so many of I Got Forgotten in an ex hospital or emergency room or whatever. I'm starting to think that they're just breaking in while everyone is gone, like while it's closed, and they just walk in or something, because that's not normal. Again, the whole staff doesn't just magically disappear. It's weird.
So hello, Bayonet Point. You sent my dad home. You discharged him.
The guy was like, oh, whatever.
Still in his arm. You let him
Not
walk
an
out
IV.
and get in an Uber with an IV in his arm. He is on his way back.
Well, first, that's not an IV. And that's the extension. Oh. Sorry. Dorian. That's the extension to get an IV. To connect the IV, I believe it's called a cannula. I mean, yeah, they should have obviously not left it in. But it's honestly not that big of a deal. By the time whenever they are, so whenever they apply it, yes, they apply it with a metal needle. And then they take out the metal needle. And you're left with a flexible plastic one. It's not that bad. You just gotta slide it out and put a band-aid on and you're fine. It's not, yes, that was silly of them for leaving it in, but honestly not that big of a deal. Nothing's gonna happen to him. His guts aren't gonna fall out once he pulls it out. Okay, couple things. Sure, you're in pain, But if you have this energy to put up your phone and record yourself while you moan there, you're not in that much pain. Two, doctors and nurses don't just randomly pick a time or an amount of medicine and when to give you the medicine just because it's a fun number or they just feel like it. There's always a reason. These people dedicate their lives to medicine. There's a reason why they're doing what they're doing, at least 98% of the time. If they told you cannot have any more pain medicine, there's a reason. You might have underlying difficulties with your liver or your kidneys or your tummy. We don't know what the problem itself is. When I was having medical issues, and I had to stay at the hospital for multiple days, I was in a lot of pain, and they would give me morphine, and I would ask them for more. They would tell me, no, you cannot have more. You need to, digest this, basically. Your body has to process this. If you give me more, it's going to cause more problems. And it did. It was horrible. Morphine didn't help at all with the pain, and I was so constipated I couldn't even stand straight. Just walking was painful. But yes, 98% of the time, there's obviously a reason why they're telling you what they're telling you. It's not because they're bored or they hate you, specifically you. There's a reason.
A nurse retaliated against a colleague who frequently stole her lunch but ended up being fired. According to the nurse, food she kept in the staff refrigerator often went missing, leaving her to work long shifts without eating. She said the problem continued for weeks and that complaints did not stop the thefts. Eventually, she decided to take matters into her own hands. The nurse said she placed a laxative into her own lunch and left it in the refrigerator as usual. Later that day, the food disappeared again. She then watched the restroom area and noticed a coworker she had long suspected going in and out of the bathroom several times. However, the situation quickly escalated. The coworker reported the incident to hospital management. Security footage later showed that the lunch taken from the refrigerator belonged to the nurse. The hospital also tested the remaining food and confirmed the presence of a laxative. Hospital officials said the nurse was terminated for placing a harmful substance in food, calling it a serious safety violation. They stated that intent did not change the risk involved. The nurse argues that she was the victim of repeated theft and believes the punishment was unfair. She is now preparing legal action against both the coworker and the hospital. If your lunch kept being stolen at work, how would you handle it?
Well, I am definitely in the nurse that got fired side. She always had a problem. She kept getting her food stolen. She went to management multiple times, tried to resolve the problem, like it's supposed to be. They didn't do anything. The other nurse didn't care, kept doing that. Nurses are very busy. They're doing constant work. They're known to have extremely long, exhausting shifts. So I can't even begin to imagine going through a whole shift, doing all that work without any food. I would be livid. And at that point, that is dangerous on its own. So, and the other nurse did not care at all. So, yeah, I completely understand. She had to do something about it. She did the laxative thing, which is beautiful, classic. And now she's the one getting in trouble. Yeah, I agree. That's completely unfair. That they shouldn't have fallen on her to resolve the problem. It should have been management, but they failed her. I hope she gets her job back, or even a better one yet.
This week, 4 times this week. I know my daughter's office is at 1:45. Waiting, I come in at 1:10 because my appointment's at 1:20. It is now 1:45.
being called being a courtesy.
Because if I would have showed up at 1:50 instead of 1:15 or 1:10 for my 1:20 appointment, they would have canceled it. And it was mine. Right? That's how it goes.
No, it really is. I mean, there's clearly someone who's never even worked in the field or never had to work under a schedule. Well, first, the calls or the text telling you to have an appointment, it's out of courtesy, and because they, out of experience, they know that people, a lot of people, don't have the responsibility to plan ahead for the day of the appointment and to arrange what needs to be arranged so they show up on time or they show up late. So yes, they have to constantly remind them. Now, her complaining that the doctor is late, yes, every case is different. Some people need more time than others. Some might be emergencies. She doesn't seem to be in distress at all. She had an appointment. It's okay. You can wait for a little bit. I would much rather a doctor take their time treating whoever needs the care, rather than half-ass talk to them and then kick them out and just keep cycling the patients. It's not that big of a deal. And yes, they would cancel the appointment if you were the one who was late 30 minutes, because again, there's already a schedule. They're not gonna make other people wait or lose their scheduled time because of you. There's a lot more people on that side than on the doctor's side. There's a reason why there's schedules. It's okay. You can wait.
Being treated like a drug. Because my labs seem fine. But I have a kidney infection.
Okay. Couple points. Yes, unfortunately, some people go and try to fake pain and to get medication. And that obviously harms the people who truly need it. And that's a problem. But I wonder if her kidney infection that she says is self-diagnosed, or she already knew she had it. Because it's not like a cut where you can see, oh, I have a cut, and there's that. You need labs and you need blood work to know that you have a kidney infection. Like, a doctor needs to tell you that you have a kidney infection for you to know that you have a kidney infection. And the fact that her labs came out fine, I mean, it is almost impossible to get your labs completely fine and have an infection. So something is off here. We're missing something. Oh, I remember hospital sleeps. She has her own room. Okay. That's what she's complaining about. first of all, I mean, we don't know why she is in the ER to begin with. For some reason, I guess they had to keep her there overnight. But she seems quite stable, quite comfortable. The other man is obviously in a lot more distress. And you can barely hear it from her room. Again, her room. She has the privacy of her own room, which is nice. She should be thankful that she is not in a bad position as the other man. You can hardly hear him. If anything, you should feel empathy for the man, not annoying. Pretty shitty of her, really. Also, again, why are you in an ER, sleeping in an ER? ERs are for emergencies. If you don't have an emergency, don't go to ERs. You're taking up the bed to someone who truly could have an emergency, like the man.
Can you not?
Oh, her ankles. Okay, that's a short one, but so many things to unpack. First of all, that's disgusting. Having your bare feet of any human on top of surfaces that are not the ground, even the ground. It's on a table, on a supposedly sterilized area where people put food, instruments, illnesses. That's disgusting and so inconsiderate for everyone else. Second of all, why not tell your kid to stop before it even gets to that point? To stop climbing and stuff. You're just risking your kid to get hurt even more, and she did. She could have hurt her ankles, she could have hurt her knees, and guess what? She busted out her stitches, which is gonna cause more trauma on her flesh. It's gonna cause some extra work for the nurses, for the medical staff, the cleaning staff, for no reason at all, other than you thinking it's cute or something that your kid is doing that, instead of you parenting and telling her no, like a proper parent, and not just, haha, oh, can you not? Like, she's just, like, it's a friend. Yeah, very, very inconsiderate. Well, I suppose this is a good spot to stop for tonight. We learned a lot. We saw both sides, from the patient and the medical. There's always two sides to every story. Sometimes one's right, sometimes one is wrong, sometimes both are right, sometimes both are wrong. It's a matter of learning the whole story and not jumping into conclusions. Always try to be the best patient possible. Don't lie to your doctors. And well, hope you had fun. Take care of yourselves. And I'll see you guys on the next Cozy Cocoon. Thank you. Bye bye.